Maybe you have to start recording.
All
There
right,
you go.
now we are recording. I'm going to share my screen. All right, you guys see that in the screen?
Yes.
Okay. So hi, my name is Haley Tamberry. I am a certified regenerative health specialist and an iridologist. I run the Detox Method, which is my wellness clinic. I work with clients both in person and remote and help find the root cause to their ailments and restore balance and alignment through their bodies with detoxification protocols using diet herbs, superfoods, and microcurrent therapy. A lot of us in this space here are qualified to help people one-on-one in the same capacity with health. And what has brought us together is we just want to share this knowledge with as many people as possible because so many symptoms are common, but not normal. And I'm really excited to lead this call today. So I just want to thank everybody for being here. I totally am nervous. I am not used to being in front of people. So I did create notes so that I can stay on track and all of that. Please hold on one second. There we go. Okay, so this is obviously a very important topic that affects way too many women worldwide. And I'm just going to try and stay on track and share as much information as possible. So here we go. We are going to change a common narrative today. We are taught that cramps, mood swings, breast tenderness, bloating, food cravings, and heavy flow are all normal. And if they're not normal, we go to the doctor and we get prescribed birth control, which just drives the condition deeper. And it completely ignores the root cause in why this occurred in the first place, which can inevitably cause more problems downstream later on. Endometriosis is these stats actually blow my mind. But endometriosis is the most common disease that you maybe have never heard of, and it's on par with diabetes and asthma. It takes on average 7 to 10 years to fully diagnose, and it affects more than 1 in 10 women worldwide, and that's 176 million women. And think about that. And this is actually a study that was done in 2019. So I would argue that that number has grown. Some women live for years without even knowing that they have it, where the only treatment plan once you are finally diagnosed is birth control and or surgery, and some women come in for multiple surgeries. And why is that? Because the root cause was never addressed. It doesn't stop there though. I have worked with women who have gotten multiple surgeries and then eventually removal of the fallopian tubes and or the ovaries, if it's gotten that progressed. The allopathic model is when in doubt, take it out. But again, what was the root cause that was causing all this to happen in the beginning? And we'll go over this during the call because the cause of endometriosis is still widely unknown in the Western medical community. Doctors are still scratching their heads, and yet it is very simple and to identify and treat naturally. So PCOS is very common. It affects 5 million women of reproductive age in the US, that's 12%. And again, the treatment option is birth control. And like endometriosis, birth control drives the condition deeper, not to mention the other side effects with it that it has on our gut, which we will learn about later. Birth control can literally destroy the tight junctions and cause an insane amount of gut imbalance with bacteria. And uterine fibroids, this is super common. I see this so much. I would actually argue that this number is higher. This is also an older study, but that's all that I could find right now. But it's all related to the same issues. So how much blood is normal? And if you guys saw the slides, you already know. But it's 3 tablespoons from start to finish, and that's 1 shot glass. So soaking through super tampons in an hour with breast pain, cramps, bloating, mood swings, and depression is all a sign that something is off, and we have to look at the health of our lymphatic system, liver, and gut. And on average, women are losing 3 to 4 shot glasses, and that is an average. Some are actually losing more, so that is shocking. So let's dive in to the root causes. So we are trillions of cells, bacteria, and 2 fluids, blood and lymph. The lymph lymph cleans and the blood feeds. And you'll hear me say this a lot because it is literally the foundation of health. The lymphatic system is considered the sewer system of the body. Its job is to eliminate all of the digestive, cellular, and waste and the toxins that we come across daily. Everything that goes in our bodies has to come out from the food we eat, the water we drink, the air we breathe, and the products we put on our skin. Everything gets picked up by the lymph and delivered to the kidneys to get eliminated through the urine. And the kidneys are a major elimination pathway, and a majority of us have kidneys that are not properly eliminating waste, meaning they're clogged. So what happens when the lymph gets backed up? We start to see lymphatic acidosis. And I always like to say you accumulate what you don't eliminate. So when your lymph gets backed up, it becomes stagnant. And we start to see some systemic inflammation. So think of this like a swamp. It's not a free-flowing river that has a teeming ecosystem on the side that is receiving oxygen and nutrients and flowing the waste, as clear crystal water. It is literally stuck. This acidosis will cause inflammation throughout the entire body, including that of the ovaries, uterus, and basically all of the fluids in the body start to get congested and more sticky. So this is one factor in understanding period health is lymphatic acidosis. So what does this all have to do with a heavy flow? Well, as primate species, our blood pH has to stay at 7.4 at all times. Your period is a really cleansing time for your body. When your system is really backed up and you are more on the acid side of the fence, AKA lymphatic acidosis, that stagnant swamp, we shed extra blood. Our body will take advantage of this time and eliminate what it does not want. When women struggle with extreme heavy bleeding, you often see anemia and lightheadedness that kind of comes along with that. Iron deficiency is related to the liver and the gut. If we are not absorbing our nutrients, then we will be deficient. And that brings us to the root cause number 2 is the gut. So anytime we see endometriosis, PCOS, anemia, the gut is always the root cause. The gut is a vital piece in overall health, including your brain and nervous system, as well as regulating your cycles. 80% of your hormones are made in the gut. And this is why. So 90% of the functions within the body are initiated by bacteria. The microbiome is an ecosystem of bacteria. Within your bowels, we are actually more bacteria than we are cells. And within our gut, we should have between 30,000 and 40,000 different species. And this is why probiotics are $1 billion scam, is because they're taking a copy at, some of them boast, 50 species. Well, that's 50, and they're taking it at a copy of 7 billion. So you're pushing out essentially all other healthy bacteria. And so these bacteria are actually what initiate communication to our brain through the HPA axis. So the gut, in my opinion, is really the first brain. So if our gut is down, our hormones are going to get off. So the HPA axis is an essential communication system. I could do like a whole talk on this alone, so I'm just going to keep it short, but it stands for the hypothalamus pituitary adrenal axis. The gut microbiota communicates with the hypothalamus. The hypothalamus sends signals to the pituitary, which is a pea-sized gland, and it's considered your master gland. It controls the entire endocrine system. It sends signals and hormones to the respective glands and organs, such as the pancreas, thymus, adrenals, ovaries, testes in men, the thyroid. What makes the pituitary not function properly is the gut, if this communication pathway is off. And if the gut goes offline, the microbiota is not healthy or diverse enough, meaning we have a depleted level, like that range that's not diverse enough. And also we can get holes in the tight junction. This is, leaky gut. And we will not, and therefore toxins and poop, for lack of better words, are going unregulated into our immune system, into our lymphatic system. So we're not going to have the proper communication if these bacteria, which are supposed to be isolated in our gut, are actually leaking out throughout our entire system. And we have an overall breach. So without this communication, we will actually create a negative feedback loop. And when the negative feedback loops get initiated, we have an imbalance in hormones. The body will start taking back estrogen and overproducing androgens, the male reproductive hormones. So when we start to see a huge imbalance in mood, depression, or feeling super anxious, heavy bleeding, more chronic conditions, meaning long-term, you start to see PCOS, endometriosis. And in addition to the HPA axis being off, we'll have an oversecretion of corticosteroids, which is actually what triggers that negative feedback loop and that imbalance in endocrine hormones. So PCOS is a common, but definitely not normal, but it's common among women of reproductive age. It's where women have prolonged infrequent periods or excessive androgen levels. The ovaries may develop numerous small corrections of fluid follicles and fail to release eggs regularly. In most cases, you see insulin resistance and excess androgen male hormones. We really have to look not only at the gut and the lymph, but also liver health when dealing with PCOS. So signs of excess androgen, the body starts overproducing androgens when that communication, like we've said, that communication pathway from the pituitary through the HPA axis goes down. We also see an increase in androgens when our body experiences low-grade inflammation. Well, why do we get inflammation? Lymphatic acidosis. If our tissues are inflamed from toxins that are just living in our system, then our body's gonna produce more androgens. Inflammation, in short, is good, right? You stub your toe, you maybe get inflamed, your body swells up, white blood cells flood the area for repair. The body will start that process. Long term, though, this turns into congestion and clotting issues. But the liver secretes a hormone to the endometrial lining to the uterus to thin the blood during a normal cycle. So if you're experiencing lots of clots, this is a liver-related issue. Another reason for increased male hormones is insulin resistance. And oftentimes when you have PCOS, you will also see type 2 diabetes. So that excess insulin. Insulin is produced in the pancreas, and it is a hormone that allows the cells to uptake sugar, your body's primary energy source. If your cells become resistant to the action of insulin, then your blood sugars can rise and your body will produce more and more insulin. Excess insulin might increase androgen production, causing difficulty with ovulation. And oftentimes that excess insulin gets deposited on the ovaries. So what causes insulin resistance? Well, fatty liver. And insulin circulates around the body, and when there is excess and it's gone to all the places it needs to go, it knocks on the door of the liver and it says, hey, I've got extra, do you need some? And in this case, the liver says, no, I'm all full, you go back out there. So it circulates around again, and it may come back to the liver again, but if this individual is experiencing fatty liver, which is a whole nother PowerPoint presentation, then it will not want to take any extra at this point. And the good news is you changing the diet, adding in more organic fruits and veggies, removing toxic food grown with chemicals, processed foods, and cleaning up the gut, fatty liver can actually turn around really quickly. So commonly we see fatty liver with people who are eating an excess amount of fats and proteins, animal proteins. So adding in more organic fruits and veggies definitely helps. So when the gut goes down, so in summary to all of what I just said, When the gut goes down, that means the microbiome it goes down. Essentially, there's not enough of a diversity of bacteria within there that are initiating all these communication processes that are making your food bioavailable for you to absorb the nutrients, and on and on. So that means, again, no communication to the brain, and then the pituitary goes down and it's not able to do its job. It's like, I don't really know what to produce here. I don't really know how to command the ship. Nobody's telling me what to do. So then we will have problems shedding blood properly and with menstruation. So if we have leaky gut, I want to touch on leaky gut again. Leaky gut is very common, and it's common if we eat acid-forming foods, food grown conventionally with pesticides, which is basically an oral antibiotic, taking antibiotics or over-the-counter medications, drinking coffee and alcohol in excess. Then these toxins, like I said before, go unregulated into the lymphatic system and the immune system, and they should otherwise remain in the bowels. So the liver has to process all this waste. So it may start storing glycogen deposits because that's what the body does. When our body's response to toxins is to produce fat to store in adipose tissue, and a lot of times the liver will automatically do that to protect itself. And the other ways is it will take calcium from bone and connective tissues. So that's when we start to look at osteoarthritis, osteoporosis, anything osteo, and it'll also produce cholesterol to buffer acids or water, so water retention. So endometriosis, let's go over this again. This occurs so a lot of the signs of it is heavy periods and discomfort with intercourse and just having a lot of pain. And this occurs in two ways. When we have the endometrial lining that continues to get thicker and thicker, the endometrial cells that are forming little polyps on the uterus over time, when the lining gets thicker and thicker, these little bits of material start to grow outside the endometrium. And they will grow on the fallopian tubes and the uterus. So some other common reasons. So the first one is embryonic cell transformation. This is when hormones such as estrogen may transform embryonic cells. And that's basically when we have an increase in estrogen. The second, surgical scar implantation. Endometrial cells may attach to the surgical incision, like a C-section, a hysterectomy, etc. And you can prevent this from abdominal therapy and castor oil packs. The next one is endometrial cell transport. That's when the blood vessels or tissues, like the fluids, like the lymphatic system, may transport endometrial cells to other parts of the body. And this is the biggest reason. Our lymphs are so congested, our cells get trapped and literally just start traveling. The next one being an immune system disorder. This is a problem with the immune system, and it may take the body is just unable to recognize and destroy endometrial-like tissues that are growing outside of where they're supposed to, the uterus. And why do you think the immune system or defense system has a hard time recognizing what should or should not belong? It's because there's a high pathogenic bacterial load in the body already from leaky gut, an unbalanced gut, and a congested lymphatic system, and livers that are overburdened. And this causes parasites, fungus, and pathogenic bacteria to increase because they are serving us a purpose at this point, to clean up that which doesn't support life anymore. Like, our bodies need help, they're bombarded. So those increase in numbers, and in this case, our immune system just can't identify what is what. It can't clear its way through the clutter. And all of this affects fertility. I mean, I've had women who I have seen that come in and say, they've gone through a fertility journey. They now have done IVF. But the only problem why they were never getting pregnant the 7 to 10 years before was because they had endometriosis. But the doctors could not diagnose them, and instead we're just like unexplained infertility, unexplained infertility, unexplained infertility. when I'm telling you endometriosis is a very simple protocol to turn around. It's an environment in the body that just needs to be cleaned up. So a lot of times these women will then go in and get that, get the tissue scraped up so that they can have an implantation. Or they, it might have progressed so far that it goes into the fallopian tubes or the ovaries. And that is not needed. Then we're going 7 to 10 years down the road, and how that's affecting our reproductive health. So my heart goes out to everybody suffering with reproductive issues. I myself was told I had endometriosis. I was told I had PCOS. I got put on birth control. This was 5 years ago. Not good. I had major gut injury, and I 100% know that is what was causing all of this problems in my reproductive organs. So in the end, if you have heavy, painful, and irregular periods and experience mood swings, this is a sign that your body needs to clean up and restore balance. So, and you know what, to be honest, like, we all just deserve to feel good, right? If we really are only feeling good 1 week out of the month, that is a big sign that something is off. Our periods do not need to be painful. So if you have a poor gut and experience heavy periods, you will likely have anxiety and depression that go along with that, as well as mood swings and food cravings. And if you find yourself reaching for chocolate or red meat, this is a sign that you are experiencing a mineral depletion and are actually craving magnesium and iron. But your liver has to help convert iron, and it won't do that if it's bombarded. So you could also be getting these minerals from better sources. And these are all things that are very common, but not normal. So getting on birth control is not the answer. The answer is to heal the gut biome, to heal the liver, and to drain the swamp, AKA the lymphatic acidosis, so you can thrive and not just survive during your period. But we first have to get these chemicals out of the body. You can clean up the diet all you want, but you have to remove the chemicals from the body. So whoever brought you to this call has access to nutrient-dense superfoods that are grown in 90 feet of topsoil using regenerative practices. The gut support alone has been third-party scientifically proven to remove up to 70% of glyphosate, which is Roundup, that lurks in our gut, and it creates a mucoid plaque. And it does this a lot with gluten. So this is why we see a lot of gluten intolerance. And it also removes 80% of C-reactive protein. So it's helping our bodies remove inflammation so that our cells can communicate again. And this helps restore balance and remove inflammation in the gut. And it's incredible. It's what I use to get myself out of chronic pain and major gut injury. I have been, like I said, diagnosed with endometriosis. They didn't tell me what I should do with it. They was just like, oh, you have endometriosis. Okay. Was told I had PCOS, and I actually got put on birth control, and it did take me out of my pain and discomfort, but it caused more problems later on. And all of that was a result of me having a major gut injury and an imbalanced bacteria in the gut that was debilitating. So basically everybody, I want everyone on this call to know, one, I work with people in a deeper way on one-on-one diet, herbal, microcurrent therapy, superfood protocols that are very specific to everybody, but we should always be treating the whole body. But not everybody needs to start with deep detox right away. We can start by adding in nutrient-dense foods into our diets, and to clean them up. I would avoid meat and dairy right away. I would avoid alcohol if you have any of these problems and you're in pain and uncomfortable. And I would add in, one's in the waiting room. I would add in nutrient-dense foods because it's lacking in our soil. So I would switch to organic immediately. And then just to add diversity of nutrients and bacteria that we are not getting from our soils, and just make those small diet changes. Sometimes the rate of injury is higher than the rate of repair, and we do need deeper herbal support. And like I said, I use diet herbs, superfoods, and microcurrent therapy in my practice, the detox method. It is very likely that the person who brought you on this call can also support you one-on-one in a deeper way. We are all in the health field in some capacity. So I'm gonna go ahead and stop the share and then open it up for question and answer.